Rabies. Rabies is a viral disease that affects the central nervous system of mammals, including humans. The virus is usually transmitted to humans through the bite or scratch of an infected animal, such as a dog, bat, raccoon, skunk, or fox. Once the virus enters the body, it travels through the nerves to the brain and spinal cord, where it causes inflammation and damage to the nervous system. Without prompt treatment, rabies can be fatal. How is it spread? Rabies is usually spread through the bite or scratch of an infected animal. The virus is present in the saliva of infected animals, and it can be transmitted to humans when the animal's saliva comes into contact with a break in the skin, such as a bite or scratch. Rabies can also be spread if infected saliva comes into contact with mucous membranes, such as those in the mouth, nose, or eyes. In rare cases, it can also be spread through organ transplants or the handling of infected animal tissues. What are the symptoms? The symptoms of rabies in humans can vary depending on the stage of the infection. The disease typically progresses through 3 stages: prodromal, furious, and paralytic. During the prodromal stage, which usually lasts 2 to 10 days, people may experience a fever, headache, muscle weakness, and other flu-like symptoms. They may also feel burning or tingling at the site of the bite or scratch. In the furious stage, which usually lasts 2 to 7 days, people may experience symptoms such as anxiety, agitation, confusion, hallucinations, and hyperactivity. They may also have difficulty swallowing and experience hypersalivation, excessive production of saliva. This stage is often associated with episodes of extreme and often unprovoked aggression, leading to the common description of rabies as mad dog disease. In the paralytic stage, which usually lasts 2 to 4 days, people may experience progressive paralysis of the muscles, starting at the site of the bite or scratch and spreading throughout the body. This can lead to respiratory failure and ultimately death. It is important to note that once symptoms appear, rabies is almost always fatal. Therefore, it is important to seek medical attention immediately if you have been bitten or scratched by an animal or suspect that you may have been exposed to the virus. Early treatment with rabies vaccine and immunoglobulin can be effective in preventing the disease from developing. What should you do if an animal bit you? If an animal bites you, it is important to take the following steps. Wash the wound with soap and water as soon as possible for at least 15 minutes. This will help to remove any saliva or other fluids from the animal that may contain the virus. Seek medical attention immediately, even if the wound appears minor. The doctor will examine the wound and determine whether you need a tetanus shot or treatment for rabies. Try to identify the animal that bit you, if possible. If the animal was a pet, get the owner's name and contact information. If it was a wild animal, contact animal control or your local health department for assistance. If the animal that bit you was a dog or cat and you do not know whether it is up to date on its rabies vaccination, the animal will likely need to be observed for 10 days to rule out the possibility of rabies. If the animal is not available for observation or if it tests positive for rabies, you will need to receive a series of rabies vaccinations to prevent the virus from causing the disease. Remember, Early treatment is critical to prevent rabies from developing. Do not delay seeking medical attention if you have been bitten by an animal. How can you tell if an animal has rabies? It can be difficult to tell if an animal has rabies just by looking at it. However, there are some signs that may indicate that an animal has the disease. Unusual behavior. Rabid animals may exhibit unusual behavior such as aggression, restlessness, or disorientation. They may also appear uncoordinated or weak. Excessive salivation. Rabid animals may drool excessively and have difficulty swallowing. Nocturnal animals out during the day. Rabid nocturnal animals, such as raccoons or bats, may be seen out during the day. Erratic movement. Rabid animals may move erratically, staggering or stumbling. Not all animals with rabies show obvious signs of the disease. Some infected animals may appear normal, while others may exhibit unusual behavior, such as aggression, confusion, or paralysis. Therefore, it is important to avoid contact with any wild or unfamiliar animals and to seek medical attention immediately if you are bitten or scratched by an animal. If you suspect that an animal may have rabies, it is important to contact your local animal control or public health department. Do not approach the animal or attempt to capture it yourself.